Hello student everywhere. Today I'm gonna talk about the normal frontalis, the frontal aspect of the skull, or we called it the anterior aspect of the skull. So as usual, at first I'm gonna talk about the bones that forms this aspect. Then after that I'm gonna talk about the sutures that connect every bone with each other, and the name of these sutures and the location of these also sutures. And after that, at the end, I'll talk about the special features in every place in this aspect, and the things that make this point special. So at first, the bones that forms the frontal aspect, they are 8 bone. 2 bone are unpaired bone, and there is 3 bone, they are paired bone. So if we collect them, 3 paired, so 3 paired, it means 6 bones, and 2 unpaired, so 6 plus 6 plus 2 equals 8 bones in the frontal aspect. So as we can see in this 3D aspect, this is the first bone called the frontal bone, and this bone, it is the frontal superior part of the skull. So this bone connect below, there is below it there is bone called the zygomatic bone. This zygomatic bone, there is bone in each side of the skull, in the left side and in the right side. This bone forms the cheek and the muscles, or we can say the face, and the lateral orbital margin of the opening eye. So this bone and this, call them the zygomatic bones, and the zygomatic bone connect medially with bone, so connect medially with bone, this bone called the zygomatic bone. There is 2 bones called the zygomatic bone. They are connected with each other with suture called the intermaxillary suture, which connected them to each other to form the upper jaw of the skull. And there is in the upper jaw of the skull, there is sockets which the teeth are embedded in them. So if we collect, there is this bone called the frontal bone, and below it there is 2 bones called the zygomatic bone, and near to the zygomatic bone there is 2 bones called the maxillary bone, and the maxillary bone connect superiorly with 2 small parts bone called the nasal bone. These 2 bones forming the roof of the nose opening, or the nose cavity. So the frontal bone, 2 zygomatic bone, and 2 maxillary bone, and also 2 nasal bone, and at the end there is 1 bone which forms the inferior part of the skull called the mandibular bone. After we talk about the bones, now we'll focus about the sutures that they articulate between every bone and connect them to each other. So we'll start with this point. This is small point. There is a suture here. There is a small suture here as we focus, if we zoom it, between the frontal bone and the nasal bone. Between this bone and between these two tiny bones here, there is a suture which called the frontonasal suture, the frontonasal suture. So if we focus, we divert this name from the two names of the bones, this bone called frontal and this small bone called the nasal bone. So we formed the name of the suture from the name of the bones. So we said frontonasal suture. So this suture is the frontonasal suture. So if anyone asks you what is the frontonasal suture, you will answer him, it is a suture which connect the frontal bone to the nasal bone. So, and if we focus here, there is a suture between this suture, it is between the nasal bone and the maxilla bone. So as we said before a few seconds, we'll derive the name of the suture from the name of the bones. So we will said the nasomaxillary suture, and also we can say the maxillo-nasal suture. Both of the names are correct. So and also if we focus here between the two nasal bone, the right nasal bone, this is the left nasal bone, between them there is a suture. We'll name it internasal bone. So the word inter means between, so it is the suture that is located between the two nasal bone. So we called it the internasal suture, and we will find suture in this place. This suture connecting between the frontal bone and the zygomatic bone, will name it as we name the previous things. So we'll name it the frontozygomatic suture. So this suture called the frontozygomatic suture, and this suture between the zygomatic bone and the maxillary bone, also called the maxillozygomatic suture. So after that, after we talk about a lot of the sutures, we still have this suture which connect between the frontal bone and the maxilla bone. If we zoom like this, you will see it. It is here. This point or this line connect between the frontal bone and the maxilla bone. So we call the suture frontomaxilla suture. And the last suture here between the two bones of the maxilla. So this suture called the intermaxillary suture, with which connect the two maxillary bones with each other to form the upper jaw of the skull. And in some cases there is a suture here in the frontal bone which make the frontal bone divided into two halves. Here a suture called the Mitobec Suture. This suture is not found in every human body, so it is present in just 9% of people. If you see this picture, it will be so obvious to you. So this suture is called the Mitobec Suture. It is divide the frontal bone into two halves, so it's just present in 9% of people. So now after we finished talking about the bones and the sutures between every bone, so now it is the time to start talking about the special features that we can find in this aspect. So the first special feature, it is found in the frontal bone. If you remembered in the first video in the Norma verticalis, I talked that in this place there is two eminences, which call them two projections. So these two projections called the frontal eminences, which if you remembered, which I said that they are the ossification centers of the frontal bone. So this, it is one of the special features in the frontal aspect. So if you say below it there is a projection here, this projection called the ciliary arch of the orbital opening. This orbital opening here, there is a ciliary arch which is arch-like. This arch-like is more prominent in males than females, and this projection forms the superior or the supra orbital margin of the orbital opening. And if you go upward to this point, you will find a projection here in the frontal bone called the glabella. This glabella, it is defined as the median elevation between the two superciliary arches, and it forms the root of the nose. This is the root of the nose. So here is a projection in the frontal bone called the glabella. If we write it, glabella, so this is called the glabella. And below it there is a point here, which is point of meeting two sutures. If we focus here, this suture, which we called it the frontonasal suture, and we called it the internasal suture. Here they are forming a point of meeting these sutures called the lesion. So we called it the lesion. This lesion, if we divide it, it is point of meeting two sutures, the frontonasal suture and the intranasal suture. They are meeting in this point and forming a point called the lesion. If you focus here in the supra-orbital margin, there is a notch, and some box call them a foramen. This notch called the supra-orbital notch. So why we called it the supra? Because there is here beneath the eye opening, there is a foramen called infra. So we called it supra because it is superior to the orbital opening, and this, it is how can I say it, it is like a pathway of a lot of nerves and veins. So if we talk about the location of this notch, we'll say it is one third medially from the supra-orbital margin and two third laterally. So it forms the 1/3 medially from the middle. So we will found this notch, we called it the supra-orbital notch. If we take a summary as what we talk about, this bone called the frontal bone, and this is the orbital opening, two orbital opening, and there is beneath it there is two bones called the maxilla bones, and there is two nasal bone between the two maxilla bone, and in the laterally there is zygomatic bone in each side. We call them the zygomatic bone, which forms the cheeks and the face, and in the inferior part there is the mandible, which is movable bone. It is the only bone which is movable in the all of the skull. So if we talk about the apertures, we will see three apertures, two orbital openings and the nasal aperture. This nasal aperture is formed in the middle of two bones called the maxillary bone. So if we start about the orbital openings, the orbital opening forms from four margins. This margin called it the supra-orbital margin, and this beneath called the infra-orbital margin, and medially there is a margin called the medial orbital margin, and in the lateral part also margin called the lateral orbital margin. So now we'll talk about the last things, the last special features in the frontalis aspect. So these the two incisors, and these the laterals. This is the incisors teeth, and this teeth called the canine. So the canine have a long root. This root cause a projection here in this point. This projection called the canine eminence, and in every projection it is necessary to find a depression. So next this projection there is a shallow depression here called the canine fossa. And now the last point, we'll talk about the foramen in the frontalize aspect. So if we start from this point, we'll talk about here a notch or a foramen called the superior orbital foramen, and beneath it here there's a foramen called the inferior orbital foramen, which pass from it the inferior orbital nerve and fossils. And in the zygomatic bone there is a foramen here called, if you focus here, this here in this point, called the zygomaticofacial nerve, which pass from it the zygomaticofacial nerves and fossils. And in the mandible there is a two foramen called the mental foramen, this and this. These two mental foramen pass from it the mental nerves and fossils. And we'll stop in this point. Thank you a lot.